So what advice would you give for patients so that they can really take a proactive approach to their healthcare and feel more confident in talking about their concerns and communicating with their healthcare team? You've shared with us how important that is. Do you have maybe 2 or 3 specific tips or maybe questions that every MPN patient should ask their healthcare provider?
I think the first thing to say is, in my personal view, is you don't have to be under an MPN expert to get the best care. I know some people differ with regard to that, but these are chronic conditions. There are national and international guidelines. Clinicians are connected. We all talk about patients all the time. We like to do that. We like to get the best for our patients. So, a local centre with a clinician who you trust, who you get on with, where you can get there easily, you trust their team, you know their logistics work for you. Maybe it's a nurse who you get on with well, who comes to the appointment with you. That's just as good as being under the best professor in the state, where you might not actually see them when you turn up and go to the unit. So that's really important. Understanding your condition, and if you don't understand, being empowered to ask questions. And if you're in a position where you can't ask a question, something's wrong. So don't be afraid. Take somebody with you, write it down. Sometimes it can be a mistake to do a trawl on the internet. So I wouldn't always encourage that, because what's on the internet is not always accurate. But go to a trusted website, ask the clinician, where can I go to find out more information? Some patient advocacy groups run buddy systems that can also be very helpful, and it can be very empowering to meet another patient with the same or similar condition. So I think those are all helpful tips from my perspective. Also, don't expect to get all the answers all the time. If it can be really tricky as a clinician if you get a patient who comes with a big long list of questions. So what is your top question that you really want answered? It's also important.
Awesome tips. I'm just going to repeat a few of them just to highlight. You mentioned prioritizing your concerns, which is incredibly important, and acknowledging that the clinician doesn't have unlimited time. And so really focusing on the things that concern you the most. You mentioned bringing a buddy to appointments, which is something I fully endorse, so that there's someone else that's taking notes, or they can be your eyes and ears during that appointment, things that you may have missed either because of anxiety or stress. And you mentioned writing things down, taking notes, even as the patient, asking questions, which is so incredibly important. And really the way that I feel patients demonstrate their involvement in their disease and in being an active member of the team. So I really, really appreciate those tips, Dr. Harrison. I think that you have given us so much information about how to empower MPN patients and their families so that they can really get the best care at the outset.